Did you know the amount of estrogen in your body influences how well your skin heals? And this is not just women, this is also for men.
Oh, it's not just becoming old and then nothing heals?
No, it's actually more complicated, and a lot of it has to do with estrogen in the body. Small amount with becoming old and have poor wound healing. But why and how? Let me tell you. So there was a research group that looked into this, like, why is estrogen so important in wound healing? Because there are numerous examples where scientists have shown that women, for example, postmenopausal women that are taking hormonal replacement therapy, their wounds grow better or heal better, and they are less likely to get pressure ulcers and venous ulcers, which is a great thing. But this has also been shown in men. Old men that get topical estrogen treatment on their wounds, well, their wounds heal better. Why? So they did an experiment that calls microarray, where they looked at how the protein are expressed. And they saw that if they removed estrogen from the equation, well, 78% of genes were differently expressed, meaning that estrogen has a lot of power when it comes to wound healing. It's affecting many pathways. And they showed that only 3% of genes were differently expressed because of intrinsic aging, meaning that poor wound healing when you're old has a lot more to do with estrogen than it has to do with being old. Estrogen influences nearly all cells that have something to do with wound healing. And that's, for example, keratinocytes, which are just the skin cells, fibroblasts that makes the scar tissue and help the wound close, and also endothelial cells, which are really important if you want to vascularize the new skin you're making. But the question is, should we be utilizing this information in the clinic? And it is quite complicated because estrogen has both positive and negative effects. For example, if you take estrogen when you are postmenopausal for a long time, well, you increase your risk of certain cancer, for example, breast cancer, which is not cool. And for obvious reasons, I think men would not like to take estrogen because they want to avoid boobies, or maybe not, and it decreases their libido. So positive and negative effects, but maybe in the future we can utilize this to our advantage, who knows?